Hello, my name's Daniel Dana. I'm a chiropractor, nearly 38 years. I'm a great believer that any profession, physio, chiropractor, will be able to help women with their hormonal issues. The gift of using our intellect and our hands has to go together, but it's an unproven science. I wanted to share with you some thoughts. I'm holding a webinar in a couple of weeks' time. Some early feedback would be helpful. I believe that the whole body can heal, that women can do it to themselves. That's just an opinion. So what I wanted to see if my thoughts, my opinions were actually substantiated. And I have a few spreadsheets to share with you how I track symptoms on a daily basis for women. Accountability and transparency in recording are going to lead us towards breakthroughs. Tiffany was a client 4 years ago. Annalise is a current client. Monique's a client that's just undergoing therapy. Let's take a look at Monique. And she's a 33-year-old, 174 centimetres, 65 kilos, endo. Diagnosed 6 to 12 months ago, symptomatic for 6 to 10 years, heavy menstrual bleeder since she was 16. Was on the pill, not prescribed due to migraine with aura, stroke risk. Implanon, hated it. Mood swings, copper IUD, hated it. She's a single mum with 2 children, worker, and severe heavy menstrual bleeding with clots, nausea, vomiting during menses, causing work and home impairment. Symptoms plateaued for 4 to 5 years despite extensive healthcare utilisation. She's seen greater than 20 practitioners, 10 specialists in the past year, multiple scans. The list goes on and on for women. But that's just to give you an idea as to what her past is. These are her goals: low back pain associated premenstrually, premenstrual mood dysphoria, so she has PMDD. It resembles the person from Split, Patricia. Premenstrual abdominal pain during the bleed, pain when I push with constipation, ovulatory pain. The list goes on and on. The reason why I'm showing you this is because Monique is just starting her health tracking, a baseline, and we rate it. We use a comparative grading scale, whereas 10 is the same as always, 5 is half as bad as it used to be, and 0 is no issues. We rate it on a daily basis. Monique started about 6 days ago. But let's take a look at this other lady. She is 46, the mother of 7, 4 miscarriages, strongly considering hysterectomy. She's got urinary incontinence, diastasis pubis, on antidepressants, been in a psych ward for 6 weeks, has business pressure, marriage issues, she's on antidepressants, tranexamic acid, prone to vertigo, bowel issues, hates getting up 3 to 5 times a week. Well, what do we do about all of that? That's like a complex case that comes into our clinic. As practitioners, it's well beyond our scope, surely. But if we document musculoskeletal, bowel, and women's health, and then we continue gold, energy, blue respiratory, green secretory, red cardiovascular, the dark blue purple is mood and concentration. So there's a whole system that I'm demonstrating on a daily basis. Now, it's all conditional formatted, meaning that when you see red, it's the same as always. When you see yellow, it's a minimum 30% improvement. And when you see green, it's a minimum 70% improvement. Well, what we can do is we can go down and we can start to actually look at just color change. What's the color doing as we actually go down the spreadsheet? She's tracking rather well in the menstrual area. And now we're seeing over a period of time context. So this lady is essentially getting a bit of a system reset. So we're seeing the color changes, and we're seeing in particular the women's health changes. If we get 50 people like this, we can pool all of the systems together. A lot of the symptoms for women's health is commonly shared between different diagnoses. So this lady is Tiffany. She's had vaginal pain, premenstrual breast, premenstrual pain, premenstrual mood, vomits prior to her period. So just awful, awful stuff for her. What I wanted to share with you is opportunity for you to record using an Excel spreadsheet, using that comparative grading system. And if you'd like to know more, then absolutely come and join me in a webinar, which will be held on Friday the 27th from 12:30 to 1 at lunchtime, only 30 minutes. I'd like to go through that, answer some questions, and introduce you to a model of care, which I think is very exciting for physios, chiros. All right, please send me some feedback if you can. Thanks for your time.